Your doctor just called. Routine screening, nothing urgent. Come in when you can. And you'll say yes. Because you always do. Because that's what responsible people do when they get older. Because you trust the system that's kept you alive this long. But I need you to stop for just one moment before you make that appointment. Because what I'm about to tell you is something I have wanted to say publicly for years. Something that goes against everything you've been told about staying healthy after 70. Something most doctors know, but almost none will say directly to your face. Some of the tests your doctor routinely orders after 70 are more likely to hurt you than help you. Not because your doctor is careless, not because medicine doesn't work, but because after 70 the math changes completely. And the system, through no one's fault, is not designed to tell you that. I'm Dr. James. I've spent 30 years in internal medicine and geriatric health, watching patients over 70 walk into routine screenings feeling perfectly fine and walk out the other side broken, frightened, and permanently worse off than the day they went in. I refuse to stay silent about this any longer. Today, I'm walking you through 5 routine medical tests I would personally never get after the age of 70. And I'm going to give you 4 questions, a protocol I give every single one of my patients, that could protect you from the cascade that is quietly destroying the health and independence of seniors across this country every single day. Stay until the end, because the 4th question alone could be the most important thing you hear this year. Before we get into the 5 tests, I need you to understand one concept, one shift in thinking that changes everything about how you approach medical care after 70. I call it the screening math. When your 50 screening makes perfect sense. You find a small cancer early, you treat it, you have 30 or 40 years of life ahead of you. The math works completely in your favor, and I would encourage every 50-year-old I know to screen regularly. But after 70, 3 things change that most doctors never explain to their patients. First, many cancers and abnormalities grow so slowly they will never cause symptoms in your remaining lifetime. You would die with them, not from them. Your body was already carrying them quietly toward the grave, and you would never have known, never felt them, never suffered because of them. Second, your body becomes more fragile. The biopsies, the surgeries, the anesthesia, the recovery, all of it carries significantly higher risk at 75 or 80 than it did at 55. Procedures that were routine at 60 can be genuinely dangerous at 78. And third, and this is the one that keeps me up at night, there is something called the cascade effect. One abnormal finding on a routine test triggers a follow-up test. The follow-up triggers a biopsy. The biopsy triggers a surgery. The surgery triggers a complication. And the complication, the one that started from a test you only took because your doctor said, let's just check. That complication changes your life forever. I have watched this cascade destroy the independence, the dignity, and the quality of life of patients who walked into my office feeling completely fine. Patients who had years of good living ahead of them. Patients who never got those years back. Not because anyone made a mistake, but because the system is designed to find problems and treat them, regardless of whether that treatment actually makes your life better or longer. You deserve to know this, and after today you will. Test 1, colonoscopy after 75. Let me tell you about Margaret. 78 years old. Outside Philadelphia, one of the sharpest people I have ever treated. She walked 2 miles every single morning without fail. Her previous doctor insisted she needed a colonoscopy because she hadn't had one in 6 years. Margaret didn't want it. She told me that. She felt completely fine. But she trusted her doctor the way most of us trust our doctors. Completely and without question. So she went. The bowel prep alone nearly put her in the hospital. She became severely dehydrated within hours. Her potassium dropped to a dangerous level. Her heart started beating irregularly. She ended up in the emergency room before the procedure even happened, before a single image was taken. And here is what makes this story not just sad, but completely unnecessary. The USPSTF, the United States Preventive Services Task Force, explicitly recommends against routine colonoscopy screening after age 75 for average-risk adults. This is not a fringe opinion. This is the official guidance of the body that sets preventive care standards for the entire country. The data is unambiguous. After 75, the risks begin to outweigh the benefits for most people. A colonoscopy perforates the bowel in roughly 1 in every 500 procedures. In a healthy 50-year-old, that's manageable. In a fragile 78-year-old, a bowel perforation means emergency surgery, a colostomy bag, weeks in the hospital, and sometimes it means death. Margaret survived, but she never fully recovered her confidence or her energy. If you are over 75 with no symptoms, no family history of colon cancer, and previous clean colonoscopies, ask your doctor whether a simple annual stool test might give you useful information without the same level of risk. And if they insist without explanation, ask them to show you the USPSTF guidance directly. Test 2, aggressive cancer screening. This one is going to be uncomfortable. I need you to hear it fully before you react. I'm not telling you to never screen for cancer. I want to be completely clear about that. I am telling you that aggressive screening in your late 70s and 80s leads to something called overdiagnosis. An overdiagnosis leads to overtreatment. And overtreatment in an aging body can be more destructive than the disease it's targeting. Studies published in the New England Journal of Medicine found that up to 40% of breast cancers detected by mammography in women over 70 are cancers that would never have caused symptoms or death. They are slow growing, quiet. The body was already managing them without any intervention at all. But the moment a doctor sees the word cancer on a report, the machine starts moving. Biopsy, surgery, radiation, chemotherapy, each one carrying side effects that can devastate a body that no longer has the reserves it had at 55. The same is true for prostate cancer. Elevated PSA levels are extraordinarily common in older men, and most of the time, they mean absolutely nothing dangerous. But an elevated PSA leads to a biopsy. Prostate biopsies cause infection in roughly 5% of cases, sometimes requiring hospitalization. I had a patient named Gerald, 81 years old, retired teacher from Baltimore, a man who had lived a careful, healthy, disciplined life. His PSA came back slightly elevated at a routine visit. His doctor ordered a biopsy. They found a low-grade prostate cancer. His urologist recommended surgery. Gerald trusted the process. He went through with it. 6 months later, he was wearing adult diapers. He sat across from me in my office and said something I will carry with me for the rest of my career. He said, "Dr. James, I wish I had never taken that test. I wish I had never known." His cancer was the kind that an 81-year-old man would almost certainly have died with, not from. His body had been living alongside it peacefully. The surgery to remove it took something from Gerald that no surgery could ever give back. Before any cancer screening after 75, ask your doctor this exact question. If you find something, what would we actually do about it? And would that treatment genuinely improve the quality of my life? The answer to that question should determine everything. I want to pause here for a moment, because what I'm about to share next is the finding that shocked me most in 30 years of practice. The test that sounds the most responsible, the most caring, the most logical, and in my experience, the most likely to start a cascade that ends somewhere nobody intended. Test 3, routine cardiac stress testing. Your doctor says, let's just check how your heart is doing. You get on a treadmill, or they inject a chemical that simulates exercise and monitor how your heart responds. It sounds completely harmless. Routine, even responsible. Here is what nobody tells you before you agree. Cardiac stress tests in people without symptoms have a false positive rate of up to 40% in some populations. That means nearly half the time. The test tells you something might be wrong when absolutely nothing is wrong. But that false alarm doesn't just disappear. It has consequences. It triggers a cardiac catheterization, where a physician threads a tube through your groin or wrist directly into your beating heart. That procedure carries real risks: bleeding, blood vessel damage, and in rare cases, a heart attack or stroke during the procedure itself. The procedure that was supposed to check on your heart can attack it. And if the catheterization shows a partial blockage, which is extremely common in virtually anyone over 70, you may end up with a stent. Here's what the research actually shows about that stent. Multiple large studies, including the landmark ischemia trial published in the New England Journal of Medicine, found that stents in patients with stable heart disease do not reduce heart attacks or extend life compared to medication and lifestyle changes alone. Read that one more time. You went from feeling completely fine, to a stress test, to a catheterization, to a stent, to daily blood thinners with their own bleeding risks, and you are statistically no better off than if you had simply taken your medication and gone for a walk. I had a patient, 72 years old, retired engineer from Ohio, no chest pain, no shortness of breath, felt strong, who went in for a routine stress test his doctor suggested at an annual physical. The test flagged an abnormality. The catheterization found a partial blockage. The surgeon recommended a stent. 3 days after the procedure, he called my office. He said, "Dr. James, something doesn't feel right." He had experienced a minor stroke during recovery. He spent 6 weeks in rehabilitation learning to use his right hand again. He had walked into that appointment feeling fine. He had asked no questions. He had trusted the process completely. If you have no chest pain, no shortness of breath, no symptoms of any kind, a routine stress test is looking for trouble in a body that wasn't asking for help. And in medicine, when you go looking for trouble in a 75-year-old, you almost always find something. The question is whether finding it helps you. Test 4, routine bone density scans. I know exactly what you're thinking right now. Dr. James, osteoporosis is real. Falls kill older adults. Of course, I should know what's happening with my bones. And you're right, falls are devastating. I have seen what a hip fracture does to an otherwise healthy 76-year-old, and it is one of the most heartbreaking things in medicine. But here is where the logic quietly and dangerously breaks down. A DEXA scan tells you your bone density is low. Your doctor prescribes a bisphosphonate medication, something like alendronate. You take it faithfully every week for years because you trust it is protecting you. And then something deeply ironic happens. Long-term bisphosphonate use is associated with atypical femur fractures, not the fractures caused by osteoporosis, different fractures. Stress fractures through the middle of the thigh bone that happen with minimal trauma. The very kind of devastating break you are taking the medication to prevent. These medications can also cause severe deterioration of the jawbone, a condition called osteonecrosis of the jaw, painful, disfiguring, extremely difficult to treat. I had a patient, Eleanor, 76 years old, retired librarian from Connecticut, who had been on bisphosphonates for 4 years after a routine DEXA scan showed low bone density. She had never broken a bone in her life. She was active, careful, healthy. One morning, she stepped off a curb, just a curb, and felt a snap in her thigh. The atypical femur fracture the medication was supposed to prevent had happened anyway, caused in part by the medication itself. She spent 3 months in rehabilitation. She never walked with the same confidence again. Meanwhile, the single most effective intervention for preventing fractures in older adults is not a pill. It is fall prevention, balance exercises, removing throw rugs from your home, installing grab bars in your bathroom, having your vision checked every year, reviewing every medication you take for ones that cause dizziness or confusion. These simple steps reduce fracture risk more effectively than any bisphosphonate, without a single dangerous side effect. If your doctor is recommending a routine bone density scan and you have never broken a bone, ask whether a structured fall prevention program might be a better investment of your health and your time. Test 5, carotid artery ultrasound. This is the last test, and in some ways the most important one, because it is the test where I have seen the most sudden and irreversible harm done to people who had no idea what they were agreeing to. Your doctor places an ultrasound probe on your neck. They're checking for blockages in the arteries that carry blood to your brain. Sounds responsible. Sounds like exactly the kind of preventive care you should be getting. They find a 60 or 70% blockage. That sounds terrifying. And your doctor refers you to a vascular surgeon. Now you are facing carotid endarterectomy, surgery to physically clean out that blockage before it causes stroke. Here is what the USPSTF says about this procedure. They specifically recommend against routine carotid artery screening in adults without symptoms. Their analysis, reviewing thousands of patients, found that in people with no symptoms, the harms of surgery, including stroke, heart attack, and permanent nerve damage, outweigh the potential benefits. The surgery designed to prevent a stroke carries a 2 to 3% risk of causing the very stroke it is trying to prevent. In older adults, that risk is even higher. I had a patient's family call me after their father, Robert, 79 years old from Delaware, underwent carotid surgery following a routine screening his new doctor had ordered. Robert walked into that hospital independently, talking clearly, living fully, managing his own life without help from anyone. He came out with a stroke that left him unable to speak clearly for the rest of his life. The blockage they removed had been there for years, silent, stable, causing him no symptoms whatsoever. The medical consensus suggests it likely would have remained that way. But the surgery to fix it, the surgery nobody told him he had the right to question or refuse, caused the exact catastrophe everyone was trying to prevent. Robert's family told me he never spoke about it directly, but his daughter said he would sit at the window some mornings and she could tell he was thinking about who he was before that appointment. He had said yes because his doctor told him to. He had never been told he could say no. Now I need to ask you something directly. Do you have a parent over 70, a spouse, a neighbor who just got a call from their doctor about a routine screening? Send them this video right now. Not tomorrow, right now. Because the information in this video could be the difference between them walking into a screening feeling fine and walking out of a cascade that changes their life forever. One share, one click, that's all it takes. And if this video reached you at exactly the right moment, if something I said today made you stop and think differently about your own healthcare, I want to know about it. Leave me a comment below. Tell me which of these 5 tests surprised you most. Tell me if you've been through one of these cascades yourself. Tell me if you're going to share this with someone you love. I read every single comment personally, every single one, because the conversations happening in this community are as important as anything I say in these videos. And if you want more information like this, information that actually respects your intelligence and tells you the truth about your body after 70, subscribe to this channel and hit the bell. I post every single day, because your health after 60 cannot wait, and you deserve a doctor who tells you the whole truth, not just the part that keeps the system moving. This is Dr. James. Take care of yourself, and take care of someone else today by sharing this video. Because somewhere right now, someone you love is about to say yes to a test they have every right to question. Give them the chance to ask the right questions first.